Okay, Dr. Prakash Marathe, you can present your first talk. Yeah, na?
Hello, good morning, everyone. It's the pleasant morning at Patna here. Most of the ophthalmologists have been doing phacoemulsification, but other type of surgery is SICS. And you have to take the decision whether to go for phaco or SICS from patient's perspective. Sometimes the patient is asking you whether you are going to do phaco or SICS. So when the patient comes to you, probably you have to define yourself. What type of surgeon are you? There are various surgeons classified in these three categories. The first one is you can declare yourself as pure manual SICS surgeon, like Dr. Jagannath Boramani, then few others. They are purely doing SICS surgery. Then most of them are pure phaco surgeons. They treat themselves as phaco surgeons. And third category is they have expertise in both these types, like Dr. Suhas Haldipurkar. They can handle both type of surgeries when the patient comes. When they want to shift the surgery from SICS to phaco or phaco to SICS, whatever decision on the table they can take. Suppose there is phaco getting complicated, they can shift to SICS. So that is third type of expertise. So before tackling to the patient, I think you should define yourself which type of surgeon are you. Next is phaco versus manual SICS. There are few things you have to explain to the patient, both the procedures before proceeding further. I think they talk some rubbish like laser surgery or some dynamic surgery or some different type of surgery in their minds. So what are the pros and cons of both these types of surgeries? You have to explain to your patient. Then suppose he is in two minds, whether to go for phaco or SICS. You have to facilitate for his decision what type of surgery the patient wants to do. Sometimes there is a doubt about costing of the surgery. So for that you have to justify what type of surgery you are going to do and what is the cost. So you have to correlate accordingly why the cost is little different. Maybe it is related to your machinery, maybe it is related to your type of IOL, your type of machine of phaco surgery, and why the cost is little more or little less. There are SICS surgeons charging 1 lakh to 2 lakh, and they are telling that my cost is 2 lakhs. The cost of IOL is only 5,000. 1,95,000 is my skill cost. The surgeon in Pune, Raju Raut, who is my friend, because what he says that it is the skill I am charging you, not the IOL, not the machine. And that's what you should be able to do. Then place of surgery. Suppose where the phaco facilities are not available and you are trying to do phaco, it is not done. Suppose SICS equipments are not available and you are trying to do SICS, no, it is not done. So you have to be well equipped with the type of surgery what you have planned. So the equipments available are very important. If you are doing phaco, all those setup must contain everything in that relation. Sometimes there is the issue of ambulation, very small incision. So that time probably the phaco is motivated by the surgeons and even the patients and relatives, they feel that phaco can be done. But even in SICS now, the ambulation is very fast. In case of insurance, like insurance companies, they are insuring maybe phaco and not SICS. In foreign countries, I think SICS is not acceptable to them in their records. It is only ECC and then phaco. We, under the platform of AIOCMTC1, are trying to say that SICS is also one of the fantastic surgeries, and that option must be kept in mind. Even residents are taught ECCA and directly phaco. So they do not know what SICS is. That's the picture what you have seen in America, Australia. But they also must be taught this type of surgery. Suppose there is some complication while doing phaco, they must be able to shift that to SICS. Recently in Australia, there is one experience. There were hypermature cataracts. They were not able to handle with phaco. One of our Indian doctor went there and showed them SICS. They were pleased. There was so much of crowd in front of that surgeon. What new technique is being delivered by that patient. The whole nucleus was seen. And I think they were amazed to see that technique. So we should motivate that technique to even abroad. So type of lens, what type of lens you are putting, there must be some transparency about the costing of the lens. And then the patient gets convinced and he pays you properly. Astigmatism, what they say it is less in phaco. And little bit myopic astigmatism is seen in SICS, but it is better for near vision. Without glasses, probably the patient is able to see. That is a positivity. Multifocality, of course, in Phaco and SICS also you can put multifocal lenses. Smart SICS is a technique which is developed by Dr. Rajiv Raut. What he says, even multifocality can be achieved in SICS. What type of surgeon? Accordingly, the type of cataract also you must assess, type 1, 2, 3, 4. And in hard cataract, you can go for SICS. Soft cataract, of course, you have got both those options. Black and brown cataract, Phaco sometimes is difficult. Of course, in experts' hand, even they can do Phaco in a nice way. So condition of cornea, what they say in Phaco, probably it is very well maintained, endothelium and all that. Some SICS surgeons, they say even they can maintain very nice condition of cornea. But transparency of cornea before operation, sometimes if it is good or not good, accordingly also you can decide if there is some opacity in that part of cornea, what type of surgery you are going to do. Sometimes the other eye surgery is also done beforehand. What type of surgery is being done on that eye? Patients have got some hesitation whether to go for same type of surgery or some different type of surgery. If you want to do the combined procedure, I think the type of incision, site of incision may be a little different. And to decide about Phaco or SICS is also a very important step. Previous operation on that eye, suppose it is done, again, it decides what type of surgery you are going to do, whether it is SICS or Phaco. And I think these all things you must decide yourself as well as patient's expectation to go for Phaco or SICS. I think with all this, I have tried to clear your doubts about that type of surgery. With these words, this is my humble appeal to vote and support for Joint Secretary. Thank you. Thank you so much.
Thank you, Dr. Prakash. So, Dr. Abdindu to be ready. But in the meantime, Dr. Prakash, one message is very clear which you have given to us, that you may be a very good Phaco surgeon, but still SICS should be known to all. You really never know when it comes to your rescue. And yes, in the country, probably 60% of the surgery is still done by SICS.
Yes.
So it's a very well accepted technique. And now, recently people have started doing a 2 millimeter SICS.
Yes.
Right? So with a snare, you can cut it out and bring it out of 2 millimeters. So if
Dr. Amulya Sahu has been doing that.
Amulya has been doing it. So if you can do SICS out of 2 millimeters, then that is also equally a good future as Phaco. And a economical system for the country and for the doctor and the patient.
Yes, sir.
Thank you.
Thank you. Thank you so much.